Imagine your home blood pressure monitor shows a number that makes your heart race, a reading much higher than usual. It is a moment that can feel unsettling and lead to a rush of questions about what to do next. When is it time to head to the emergency room, and what exactly happens when you get there with a blood pressure crisis? When you arrive at the emergency room with a blood pressure crisis, the first step is triage. Triage is a vital process where medical professionals quickly assess your condition and the severity of your symptoms to determine how urgently you need treatment. For a blood pressure crisis, this means evaluating not just the numbers, but also whether that high pressure is actively harming your body. The reason triage is so crucial for blood pressure concerns is that not all high blood pressure readings requiring the same level of immediate intervention. A very high blood pressure reading without any accompanying symptoms or signs of organ damage is often termed a hypertensive urgency. This needs prompt attention but might allow for a bit more time. However, if that high reading comes with symptoms like severe headache, chest pain, vision changes, or shortness of breath, it could signal a hypertensive emergency where vital organs are at risk. The triage team needs to rapidly differentiate between these two scenarios to ensure those experiencing an emergency receive care without delay, while still addressing the urgency of others. So what does this look like for you as a patient? After checking in, you will usually meet with a triage nurse. They will take your vital signs, including your current blood pressure reading, heart rate, and oxygen saturation. They will then ask you a series of targeted questions. Be prepared to describe your symptoms in detail, when they started, what they feel like, and if anything makes them better or worse. Share your full medical history, including any pre-existing conditions, and a complete list of medications you are currently taking, both prescription and over-the-counter. This thorough questioning helps the nurse understand the full picture and decide if you need to be seen immediately or if you can wait for a doctor in the main waiting area. Here is an insider tip for navigating this process. Focus on clearly communicating your symptoms. While the blood pressure number is important, the presence of symptoms is often the critical factor in how quickly you are seen. For example, mention any new or worsening headaches, dizziness, blurry vision, chest discomfort, or weakness. These details help the team identify potential signs of acute organ damage, which would elevate your priority. Understanding that a reading of, say, 180/120 with symptoms is a greater concern than the same reading without symptoms truly helps you help them provide the best care. Ultimately, the emergency room triage system for a blood pressure crisis is designed to be your advocate. By providing a comprehensive and honest account of your symptoms and medical background, you empower the medical team to make informed decisions swiftly. This structured process ensures that individuals facing the most immediate risks receive timely treatment, while everyone gets the appropriate level of care, guiding you safely through a potentially stressful situation and towards a stable outcome. It is all about getting you the right care at the right time.